So every woman and baby matter. And what we've got to really think about is how can we as health professionals do our best? And what I've seen as a consultant and in my training as a doctor is that it's when we work together, when we work as a multidisciplinary team, we get it right. I trained as an obstetric physician, so I am the bridge really for all the experts and trying to better understand and be an advocate for the pregnant mother. So let me tell you the journey about this course. Okay, I'm really pleased that this is the second year that we're running the Essentials in Obstetric Medicine for KHP and King's College University. I think it's a necessary course, and I've spent many years of my life developing this. About 10 to 12 years ago, I actually started and commenced a bid to look at multidisciplinary training in South East London. With this bid, I was better to understand a course where we brought people together and looked at a pregnant mother. So the Essentials of Obstetric Medicine was made with a vision to support doctors and midwives and other health professionals learning together, training together, because that's what matters. In the past 2 years, we've now had more than 50 people go through our module. It's an intense module. It runs for about 12 weeks. At the moment, we have 60% midwives in it, 40% doctors. We also have a paramedic. They've been learning and training together for the past 3 months. And what's been beautiful is we started face-to-face. We've had virtual meetings every Thursday. And today is the first day of our day 2 and our final part of our course. The past 3 months, we've been giving our delegates information, knowledge. What we've asked them to do is use their professional curiosity to drive themselves to learn more. What now needs to be done with that is to deliver good clinical leadership and the skills and the tools for implementation. And that really comes from quality improvement. We all know that we are a piece of the puzzle. We all know that there's this cogwheel around us, and us all sharing together, having that professional curiosity is going to make a difference. My own vision is that we develop this PG cert in women's health, in obstetric medicine. Then we go on to develop a diploma. And the future then is a master's in obstetric medicine.